Hi, so my cognition critique article was on media multitasking and its effect on memory. So, to introduce the article, it focused on the cognitive principle of memory and partially on attention as well. But in summary, the study was about media multitasking and its effect on attention, long term memory, and working memory. Specifically, they wanted to answer the following questions. Firstly, do heavy media multitaskers exhibit lower working memory performance, even without an external distraction? Secondly, do heavy media multitaskers have impaired long-term memories? And lastly, they wanted to look at whether intentional impulsivity correlates with reduced working memory performance. So the study was important, firstly, to understand cognitive consequences. As avenues for media consumption increase, it's important to know the safest way to consume it with the least negative cognitive effects. Secondly, for educational and policy implications. By investigating how media consumption influences memory, the groundwork is laid for optimizing cognitive performance among students. For the method, they used a quasi-experimental design, recruiting 143 participants from Stanford University, meaning they used convenience sampling. And then to analyse the results, ANOVAs and regression analyses were used. In terms of the procedure, a set of questionnaires was used first, including the Media Multitasking Index and inventories for impulsivity and ADHD. Next, 4 cognitive tasks were used, specifically 2 visual working memory tasks and 2 recognition memory tasks. The first one was the rectangle task. So in the first photo, they had to remember the position of the 2 red rectangles and ignore the blue distractor rectangles. Then there was a delay period, then they had to determine if either of the red rectangles had changed position. The second task had the exact same instructions, but instead of rectangles, common objects arranged in a circle were shown. Next, they had the recognition memory tests. So in this test, the target objects from the working memory task they did earlier were mixed with new objects. Then they were asked to identify whether each object was old, so presented in the last task, or new, meaning it hasn't been presented before. They also were asked to indicate their confidence level for the decision. After this, they did the same test, but for this time, the distractor objects from the working memory task. From the MMI questionnaire, they identified 36 HMMs and 36 LMMs, and then the results of these two groups were compared. First, on the impulsivity index, they didn't differ, but on the ADHD index, HMMs were significantly higher than LMMs. Next, for the working memory task, HMMs had lower discriminability and a deficit in encoding and maintaining task-relevant information. Lastly, in the recognition tasks, HMMs had a bias to endorse objects as already recognized, showing encoding and retrieval errors in long-term memory. But to summarize these results, the tests on working memory indicated HMMs have a deficit in encoding and maintaining task-relevant information in working memory compared to LMMs. The tests on long-term memory found that the working memory deficits were actually affecting the encoding and retrieval of long-term memories. And they also found that higher self-reported intentional impulsivity was associated with worse discrimination in working memory. So the strengths of this study were they utilised multiple tasks for comprehensive assessment. They had a large sample size of 143, ensuring statistical robustness, and they highlighted the implications for education and policy and the further research that's needed in this area. However, the limitations were they relied on self-report measures for the media multitasking and impulsivity scales, and there's also limited generalizability due to the sample population being only from Stanford University. Lastly, the directionality of effects wasn't established. So overall, the study revealed that chronic media multitaskers show deficits not only in working memory, but also long-term memory. These deficits are influenced by a broader attentional scope, impacting the competition between relevant and irrelevant information. The findings also highlighted the importance of establishing causation, so proper media hygiene can be developed, and educators, policymakers, and parents can make informed decisions, particularly regarding academic performance. In summary, this study was a valuable starting point, establishing a correlation between media multitasking and deficits in long-term and working memory. However, further research should recruit a more representative sample and look into establishing causation.